Okay, what I've done is I've put together a presentation which is going to walk you through Couth, which gives you a visual idea of what we've done visually with the service. But I'll just tell you a little bit about the history. Couth's been going, actually 11 years in March, so we've sort of been going quite a long time really. And when we first started in, set the company up in 2001, when we talked to people about the idea of delivering mental health services online, people looked at us as if we got two heads really. It was very, very sort of, early days. But anyway, in the end, we did get there. We did find a really lovely, friendly person in the local PCT who was willing to kind of give the project a go and help. And we did some consultation to high schools in Stockport and Bridlington Youth Centre. And we involved young people right from day one in terms of the design of Couth, the look of Couth, and that's been history all along. And just to take Christina's point, the Couth you're going to see tonight is version 5 or version 6, so it constantly gets changed, constantly changing, and we've learned the hard way that working with external developers and external designers just sometimes gets very expensive and slows the process right down. So we now employ our own kind of designers now. Designers kind of, we tend to do it on a project by project basis, but we've definitely got our own in-house programming team. It means we're able to respond very, very quickly to feedback and to change much, much more easily. And one of the other things we've noticed over the last year and a half, I would say, is that more and more young people are accessing Couth through their mobile devices, through their phones. And I've got to be honest, the current Couth site, although it works beautifully on an iPad and it works beautifully on a computer, and you can access it on a mobile phone, it's very difficult to access the chat bit of it, the live counselling bit of it. So this year, in 2015, we're going to be developing a Couth app to kind of like, make sure that we're kind of right up with the time. Right, okay, now I'm going to use buttons if that's okay. Right. Hang on a second, what are the pictures showing? Why has that happened?
I don't think their version of PowerPoint works some of the presentations.
Okay.
Told that.
Okay. Oh dear. I shall talk you. It's a shame though, isn't it? You've got to listen to me rather than look at you. You've just got one picture. Okay. Okay, well I'm really sorry about that. What I suggest you do is maybe tonight go home and look at Couth.com and have a look at it. What we did was what we did with Couth. I'll tell you a little bit about Couth. What Couth is an online counselling service that's staffed by professional counsellors, psychotherapists and mental health support workers. And we essentially, young people can access the service through they can access different features. So there's lots of stuff in there about self-help, lots of stuff around documents they can download, games they can play around self-help and their mental health. There's also moderated peer forums where we have live discussion forums moderated by a counsellor and a moderator, where young people kind of like talk about the things they want to talk about, and they're like live chat rooms if you like, so like live discussions. We also have a magazine, which is, I think about 80% of the content in that magazine is actually produced by users, so users write about their own stories. So there's lots and lots of stuff on there about young people supporting each other. And then alongside that, we've got an excellent counselling and psychotherapy team who essentially will offer one-to-one counselling through encrypted chat rooms and through a messaging system as well. So if young people don't want to come into kind of the chat room, they can use a kind of like almost like an internal email system where they can kind of write their story, the counsellor will read it right back to them. And a lot of young people actually like that system on the live chat. And the whole point really about Couth is making sure that we reach those young people that wouldn't feel able or willing or ready to access face-to-face services. So at the beginning, when young people come into Couth, we ask where they heard about us. And we get a whole spattering of different responses. We get about 11% have heard us through the GP, about 7% hear about us through parents, probably about 20% get hear about us through a friend, but the biggest is through school, because the whole point really about Couth is making sure that we go out there and we talk to schools and we talk to young people before their problems become too big. The whole point really is to try and help prevent young people going on to developing long-term chronic mental health issues. It's about early intervention. So it's very, very heavily self-referral. Young people get signposted, they get told about Couth through our work in schools or through our work with other agencies, but they choose to come, and I think that's really, really important. And the whole point is to sort of try and, like I said, get that early intervention going really with young people. One of the lessons we've learned is because we get funded through NHS trusts and local authorities, we're a business, we're a social business, so everything we earn we earn through contracts. We've never been given a single penny of government grants or anything like that. We have to go out and sell our service. And essentially the whole point really is to sort of like make sure we're part of that health economy, but delivering services in a kind of a new kind of digital type way. So I'm a bit lost because I'm a bit... Right, so you can't see it, it's a real shame. One of the things we did with this version of Couth was we did lots of focus groups, and we constantly get feedback on the site. So young people are constantly telling us what they like about the site, what features they like, what they'd like to see changed, and we use that feedback to rebuild the system. Like you were saying, Christine, it's never finished. There'll never be a definitive end to Couth. So essentially it's all about kind of that feedback. And our latest bit of feedback, in our latest kind of build, one of the things young people said to us is they wanted to be able to personalise the site. So we've built a site where young people can select them and create their own backgrounds. So again, it's all about co-produced kind of look and feel, co-produced design really. And then we've got like a very, very quick registration page where young people go through. And again, when we first started Couth, we wanted to collect lots and lots of data about who the young people were, and we got told very, very quickly we wouldn't bother signing up. We're not willing to give out lots of personal information online. So we built a very quick registration form, and all we ask at the point of registration is what area of the country they're from, what neighbourhood they live in, what their gender is, what their ethnicity is, what year they were born, and what birth sign they are. And then we ask them to make the username and password and where they heard about us. And that's all we ask at the point of entry. So it's like that, and it's done. They're in very, very quick, you see. And then once they then enter into the chat rooms, the counsellor will then use an assessment process to kind of build up a relationship, build up the trust, and get more information from them. And those of you who are social workers in the room will know about the Common Assessment Framework. That's the framework we use to build up the young person's story, to build up the narrative. So we're looking at young people's environmental backgrounds, we're looking at what good relationships they've got with parents, what relationships they've got with friends. So we're building up a picture of what support systems those young people have got around them, because essentially at the end of the day, digital support is one arm of the support, but that young person also lives in the physical world. So it's about matching those two things up together. It allows us to measure safeguarding, it allows us to look at the young person's risk around self-harm, suicidal ideation. Do we need to be working in partnership with other services around supporting this young person? So although Couth is an online service, part of what we do when we win another contract is we make sure that we've got relationships with other services in the area so that we're able to actually offer those young people joined up support. I mean, about 89% of our young people only will use just the service online. About 11% of them will need to be working with them in conjunction with those services. So it's just about making sure that those kind of safeguards are in place. So we get all that through the registration, and we also get that through the relationship the workers have with the young people. It worked! Okay, very strange. Okay, so this is part of the registration, as I've said, and what happens is it's built very kind of visually, so you do what's your username, and the next one, my password will pop up, and then that will pop up, and then that will pop up. Interestingly, in this version of Couth, one of the things we found was, because young people wanted a really kind of funky, kind of really good site, was suddenly we realised that we had some issues with some schools because they were using such old, they were still running Microsoft 5, version 5, version 6, and it wasn't compatible with new technologies, with new web technologies. So we've had to kind of like build some versions which kind of will work on old technologies. A real problem for schools, because they're actually using such outdated technology, it's actually they're opening all sorts of problems for viruses, hackers and everything like that. So that was an interesting lesson for us. It's not working again. It's got a mind of its own, isn't it? Okay. So so some of the slides are working, some aren't. I'm not quite sure why that is. So essentially, when a young person books in, they can message the team. They can, when they've got booked to chat with their counsellor, it will appear at the top for them to remind them when their next date is. They can go to meet the team, so they can check out the counsellors, see who they like the look of. They can also can refer themselves into face-to-face counselling. In some areas of the country, we ourselves provide some counselling in schools and in the community. Where we don't provide a face-to-face service, we've got partners that do. So we make sure we're linked in with other face-to-face services, so we can link in there. There's an activity button where they can download games and things. This is excellent. My goals. Part of the way that we measure efficacy of our service is through using outcome measures. Which, especially when very, very important in health in particular, you've got to show your outcomes. And we've got various outcome measures we use. And my goals is one we've worked with the University of Manchester on. It's called the COGS, Counselling Outcome Goals. And essentially what it is young people set goals around life, immediate goals, life goals, and early goals with their counsellor. And then they can kind of measure how far they've got with those goals. And that's been really successful with young people. They've really liked that. They've also got a thing called My Journal where they can record their feelings, their moods, their thoughts as well. And again, they can use that in conjunction with their counselling, or they can use that as part of their sort of self-management really tools. So everything's sort of personalised. This is a page from our Meet the Team. We're members of the British Association of Counsellors and Psychotherapists. That's our ethical body. And counsellors make sure that they put their kind of qualifications on there so that young people can see that they're kind of, they know what they're doing, and they can find out about different counsellors who work with us. Okay, so this is the forums. Again, this is all, the forums work in two ways. We have static forums, which is where young people can literally write on the forum, and then it's moderated by a worker. And we have live forums where we have live discussions, so the discussions are live and fast moving. And again, you can sort of see the top 10 discussions, the latest comments on there. This is something from our self-harm page from the forums. Again, lots of stuff on there. See, it's very, very laid out. Okay, these are games. This is our message. Some of the things that young people can do, we have what we call a front of house team, so that when young people go into the chat room, we've got a front of house team that will automatically kind of pick them up, check out what their issues are, triage them in a way, find out whether they can get some support from a support worker, whether they need to see a therapist, and also kind of pinpoint them to kind of some of the forums and magazine articles or live discussion groups that are going on. So we make sure we pick young people up as quickly as possible. This is our, what happens in our chat rooms is that we've got two panels. So this is the live chat bit here, and here you've got the bit where we can upload, the counsellor can upload kind of assessments, can upload their goals, can upload their wacky core scores, which is a way of measuring risk and distress levels. So this panel kind of like it's shared with the young person, so we can kind of share information together. We can share websites that are of interest, and we can also share worksheets that we can work with in the chat room with the young person. So it's very, very kind of interactive. At the top there, you've got this is the counsellor's view. You've got case notes, face to face. There's all of our kind of like tabs at the top there that help us manage the service. So that's what the Wacky Core form looks like. It appears live, and the young person ticks it live in the interactive box. And in the counsellor's end, you can see their scores come up, so it's all very spot. Okay, this is a picture of the goals that we've got that I was telling you before. Some of the goals that young people set with the counsellor: go and see my GP about feeling very low, make it to the next CAMHS appointment if they're in CAMHS, or and this is from the worker's perspective. We can see how far they've got with their goals. Some guys from exam, tell the teacher about being bullied, tell my mum about self-harming, ask Amy out on a date. I mean, these can be all sorts of issues that young people talk to us about, really. This is the CAF. Those who are social workers will know this very well. Essentially, this is the way that we kind of measure what presenting issues young people have come up with, and also the status key lets us know how they're using the service as well. This is a picture of our casement system. So at a glance, the worker can sort of see the whole picture around that young person and the work that's been going on with them. The other important thing is our signposting system. One of the things that we do when we get a new COOF is we make sure that we've got to know every single service that exists on the ground in the community, so that we're able to signpost young people to those services and make sure that we're kind of picked up. We can also do live referrals as well. So that's Cornwall. That's Cornwall, some Cornwall stuff there. Okay, and this is what the young person sees. Your counsellor thought you might find this information helpful. That comes into their inbox. So, and again, that's why it's the skill of the worker to work out whether the young person needs to be signposted or whether we need to make an active referral, and that depends on the young person. So referral assessment is really, really easy. We do take targeted referrals. So when we work with like yacht teams, youth offending teams or social worker teams, we've maybe got some really vulnerable young people that they want us to work with online, we will take referrals over the phone. But most of the work we do is young people coming to us, self-referrals. Okay? I think that's everything. The stepped care approach. I'm really sorry you can't see all these slides. That talks about the 3 ways we work with young people. A lot of the work is just drop-in counselling, 1 or 2 sessions. The next bit of the triangle is stepped, is the structured counselling sessions where we might work with over a long period with the young person. And the top bit of the triangle is what we call our key working, and that's for our really chaotic young people who might already be involved in the secondary care systems but find it easier to talk online. People who've been involved, who've been sexually abused, for example, find it much easier to do their therapeutic work online or face-to-face, but we need to kind of make sure that we're kind of really geared into the other kind of points of the system for that, really. So that's the sort of 3 kind of layers of support that we offer to young people. Got lots of cards, posters, cards, t-shirts, pens we give out to schools and things. So we do quite a lot of going out there to people, really. That's it, I'm sorry that it's been a bit truncated, the pictures. I'm really sorry about that. Don't understand what happened there. I'm trying to think if there's any major lessons we've learned. I guess for us, the big lesson is about is understanding that like digital services like COOF you would never just run that in isolation in itself. It has to be part of the infrastructure around children and young people, part of the services. We did that right from day one. Our first ever COOF service, we had COOF online, and then we had a community outreach team attached to COOF. So we had 2 or 3 workers attached to COOF that worked in the local authority who would do face-to-face work. So I think that's the important thing, really. The message we would really give about working in mental health with children and young people is it needs to be joined up. It's really, really important. But I think Mick Cooper, who's a professor of counselling, is gone to Roehampton now. He did a big piece of research with children in schools and young people in general, and he asked them about counselling, and 46% of them said that their first port of call for getting sort of emotional health and wellbeing was through the internet. So it's a bit different from what you were saying about the older population. It is very different. We're talking children and young people are digital natives. They don't remember life before technology, so it's a different ball game, really. But even though you've got that, you've got to make sure it's safe, you've got to make sure it's joined up, and I think that's the most important thing. I'm sorry you didn't get to see the sign.
Thank you.